Ventilation and diffusion. Selected disorders. Pneumonia. Pneumonia is an infectious process. It's spread by respiratory droplets, and it causes inflammation in the lungs. It occurs commonly in the bronchioles, interstitial lung tissue, or the alveoli, so it has a ventilatory and a diffusion component. Products of inflammation accumulate and cause consolidation. Now, pneumonia is typically either bacterial or viral. If it's bacterial, the bacteria invade. They cause alveolar inflammation. And remember the whole inflammation process? There's edema, fluid buildup in the alveoli, and atelectasis. If it's viral pneumonia, the virus invades, attacks the bronchial epithelial cells. There is inflammation and desquamation. Again, there's an exudate. This often spreads to the alveoli, and the alveoli fill with blood and fluid. So, the bacteria or the virus invades. At that point, the body resets its hypothalamic thermoregulation center, and we will see fever and chills. Regardless of whether it's a virus or a bacteria, we see fluid in the lungs, so we're going to have cough, purulent yellow or bloody sputum. We'll hear crackles, and there will also be a decrease in breath sounds with the consolidation. This fluid causes inadequate gas exchange, so we'll see tachypnea, among other things. Other clinical manifestations include, well, not only does the person get a fever, but it tends to be a sudden onset. And not only do they have tachypnea, but they have dyspnea. We'll see tachycardia, pleuritic pain, fatigue, and a loss of appetite. Now, what we're trying to do is restore optimal ventilation and diffusion. So we're going to have to be asking people to do all that pulmonary hygiene stuff. Turn, cough, deep breathe, inspirometry, chest PT. Now, that includes percussion and vibration. We have to identify the pathogen and figure out which drug is going to work best. We're probably going to have supplemental oxygen. We'll have to manage the fever. And we're also going to have to manage the fluid. Make sure they get enough, but not too much. Tuberculosis. TB is caused by Mycobacterium tuberculosis. It is an airborne droplet spread, and they travel directly to the terminal bronchioles and alveoli of the lung. There is inflammatory and cellular immune responses, and we see 3 stages: containment, multiplication, and dormancy. During containment, cellular immune response is taking over. We call this asymptomatic primary TB. Asymptomatic, we don't see a lot of symptoms yet. Primary, meaning it's the first time the person's had TB. Now, we get granuloma formation, and that's called Gons foci, where the TB germs are kind of walled off. And we get groups of them that are connected through the lymph system, and that's called Gons complex. During the multiplication phase, we have the development of aggressive symptomatic disease, and this is progressive primary TB. Progressive meaning it's getting worse, primary meaning it's just the next stage of this first case of TB within the individual. During the dormancy phase, things tend to be fairly dormant, but we always have the problem of future multiplication and reinfection. You know, the Gons granular formations, we may have the TB coming out of it, sneaking out of the walled-off area, or the person may become reinfected, and then we call it secondary tuberculosis. The clinical manifestations, if we have chronic inflammation, we're going to see malaise, weight loss, fatigue, anorexia, a low-grade fever, and possibly night sweats. Night sweats tends to be one of those red flags that makes us look at the person and think, maybe they got TB. This is what we all get tested for with our skin tests. It can also be detected through X-rays, sputum cultures, and sputum nucleic acid amplification. How are we going to treat it? Well, there's 4 main antimicrobial drugs that are used. In my class, I'm not asking you to know them, but you may have heard of the INH and rifampin before. And the directly observed therapy means, if we've got someone that we're not sure they're taking their drugs, it means they have to come in every day and take their drugs in front of you. And if it's bad enough, they might be placed in isolation. However, this is not something that everybody has to go through.